Podcast, Cristo Rey Podcast, the Cristo Rey Podcast coming at you. Podcast, Cristo Rey Podcast, Cristo Rey Podcast, episode 2. Some of your favorite student council reps are back. Brianna, Blankson, Nehemiah, and Ruby. Nurse Ross is back as well, and this time she brought her sister. Her sister is a nurse too, did you know that? 'Cause I didn't know that. Podcast, Cristo Rey Podcast, the Cristo Rey Podcast, right in your ears. Podcast, Cristo Rey Podcast, the Cristo Rey Podcast. Oh boy, here it comes!
Welcome to episode 2 of the Cristo Rey Columbus High School podcast here in this time of social distancing and virtual learning. We'll start off just by welcoming back our regular panel members and student council members. If you guys want to go around and just share one thing that you have as a takeaway from this past week of social distancing and virtual learning that you want to share with the audience.
It's Brianna Blankson. One thing that was different from last week I feel like I was a bit more prepared for this. Like I was getting up at exactly 9 o'clock. And then for some reason this week, I can't wake up at 9. It's been like 10, 11, 12, around that. And it's been really weird. But yeah, I don't know if anybody else has been like that. But I can't wake up early. So yeah.
I relate to you, Brianna. Hi, I'm Ruby. And one thing that I've had to face this week was having to focus for a long period of time, especially with your test, Mr. Divo. I'm not sure what happened, and having to focus for a long period of time for a test has been a struggle that we're not really used to, because especially at our houses, I feel like I can speak for a lot of us that there's more distractions around. Well, yeah, that's been one of the new things I've had to come to terms with.
This is Nehemiah, and one of the things I would say has been the hardest is how codependent I've been on others. Like now it's literally like it's just you, like making your own schedule, having to keep yourself not distracted, and just overall like having your own structure of like some of the boundaries that you had for school aren't no longer there.
So I want to take this time to introduce our guest. So first of all, we do have again joining us, Nurse Ross is here. So hello, Nurse Ross. Thanks for being here again. And she has brought her sister, Becca Hunt, who is a nurse practitioner at Stanford University in San Francisco, California, sunny San Francisco. So she's going to tell us a little bit about her experience as well with sort of the issues related to the pandemic and offer us sort of a comparison point between California and Ohio. So welcome, Becca.
Hi, thanks for having me. My name is Becca, as Mr. Diebel was saying, and I'm a nurse practitioner at Stanford. I live in San Francisco. Stanford is in Palo Alto, about 30 minutes down south. And there have been a lot of changes here. San Francisco was one of the first, I think it was the first city to go on an official lockdown. So we've been on lockdown since March 16th. And I am excited to talk to you guys more about my experience in San Francisco and tell you about my experience in the hospital specifically during this time.
Great. Thanks so much. Becca. Yeah, thanks for being here. So we're going to kind of hand it over to you and the kids here to sort of get your experience and things like that. So why don't you just start by telling us a little bit about your personal and kind of professional experience with everything that's happened. You know, what's it like to be on the front lines, kind of fighting the disease on a large scale, but also just sort of on the micro level, what's happening in your community and the day-to-day things that you're seeing. And yeah, just give us sort of a characterization of that.
Okay, so I'll start first by saying that I'm a nurse practitioner in urology oncology. So this is mostly cancer related to like bladder cancer and prostate cancer. That's what I specialize in. So mostly the things that I'm seeing are still those types of patients, and we do a lot of surgery. So the things that I can speak to mostly is about how it's affecting the surgical cases for these cancer patients. A lot of these surgeries are getting canceled, and a lot of these surgeries are being pushed back, which, as you can imagine, is stressful for a cancer patient. Additionally, I go and I see patients in the emergency room. When they arrive, sometimes they do have a cough and sometimes they do have a fever. In those cases, I still go see those patients, even though we call it COVID rule out. I'm putting that in air quotes because we don't know if they have COVID or if they just have the flu or a cold or anything else. And I have been in rooms where people have been diagnosed with COVID. And these are usually patients that are suffering from one of the ailments one of the ailments that I work with specifically, and that is cancer. In addition, they have been diagnosed with COVID. So it's a little bit complicated. I'm not one of the emergency room doctors that's swabbing everybody that comes in, but I do get called into the emergency room and I do go and see those patients. But we have seen a big change in the things that we're doing, especially for cancer patients. And then I'll also, one of the other things you asked about was about San Francisco and the things that I am seeing. San Francisco, I heard on the radio yesterday that it was the second most densely populated city in the United States, second to New York City, which was kind of surprising to me. I would have thought like Chicago would be more dense, but that's what the radio told me. It was NPR, so I trust it. And with that said, it is really hard to stay away from people, it gives me a lot of anxiety when I go outside. And I know that a lot of people feel the same way. So I'll welcome any questions that you guys have.
Yeah, hi. I was just wondering, when you said people have cancer and some of them tend to be diagnosed with COVID at the same time, what is your treatment for that? How do you deal with trying to take care of the cancer and deal with the COVID at the same time?
Thanks for that question. It gets a little bit tricky because, most commonly we're doing surgeries for their cancer, meaning they hopefully are not sick from a chemotherapy that they received. But if somebody recently had chemotherapy, which we also have patients that have had that, and then they get diagnosed with COVID, then it's really scary and it can get really serious very quickly. And those are people that we're very concerned about. And those are people that we immediately will admit to the hospital. So instead of we swab them and we say, oh, maybe you do have COVID, maybe we'll wait and see what the test comes back as. We immediately bring them into the hospital and we put them into an isolated rooms where we can watch them more closely, especially if they had something like chemotherapy, because that depletes the immune system. And I'm sure you've heard a lot about the immune system going with all the talk that's been going on now. But chemotherapy is one of the things that do that. So those are the people that we're most concerned about.
So to kind of correlate with that, you spoke on how San Francisco is highly ranked as being dense. So can you speak on from the surgical aspect of how the protective equipment and how is that looking in your individual hospital? Are you guys under a rush and under desire and need for these masks and the ventilators, and how's that impacting San Francisco, let alone California?
Yeah, so Stanford actually, every single week we have a big meeting. They call it a town hall meeting. And all of the important doctors at Stanford, they come onto a Zoom conference and they tell us all about the things that they're doing to keep us safe, the people that are going into the COVID rooms. And one of the things that they're doing is they're keeping us updated every single week on how much PPE or personal protective equipment that Stanford has. So when all of this first started happening a couple of weeks ago, we were all very nervous because there wasn't enough personal protective equipment. And that includes the masks and the gloves. And Stanford, they did not tell us how they did it. I do not know. But now they're telling us, don't worry, we have enough. But we are having to reuse masks. We have to reuse the surgical mask that we walk around the hospital in. We only get one per shift, and that's usually 12 hours. So that's not ideal. But the one really good thing that we are doing at Stanford that a lot of other hospitals don't get to do is those N95 masks that you've probably heard about that really filter 95% of particles in the air. We don't have to reuse those. So every time I go into a room where somebody has been diagnosed with COVID, I don't have to reuse that mask. which is really nice because I know a lot of hospitals are struggling with that. And the other thing that Stanford did is they opened up the old hospital. So Stanford just a few months ago opened up this new fancy hospital that was super pretty, but they closed down the old hospital. So what they did is they opened up the old hospital back, and they I think doubled the number of ICU rooms that are available. So we have enough ventilators at Stanford, and we have enough PPE. But that's not how it is at all of the hospitals in California. And specifically, there are some hospitals that are more public. How do I say it? They're public hospitals that don't have quite as much money as Stanford does. And I know that those hospitals are in a more tough position. And some things that they're doing is reusing the PPE, but they're also splitting ventilators. Like if two people have been diagnosed with COVID and they know that both people have it, and they will put two tubes out of the ventilator and split it so that two people are using one, which is really unheard of in the medical world. But I know that that's been done in Washington, and I know it's been done in California too.
So a lot of people in the public feel like mask is a really good way to protect yourself from COVID-19. Do you feel like this is a good way to protect yourself? And what are some ways that you would recommend us to stay protected from this illness?
So thank you, Rui, for that question. And it's actually a question that I've heard so much, and I wish that I had a really clear answer about it too. But from what I know about the way that the disease is spread, is the best thing you can do is wear a mask, mostly to protect the people around you. The thing is that we're so concerned about, and the reason that the CDC did make the recommendation that everybody wear a mask is not so much because we are afraid, or we are protecting ourselves from COVID-19. But the thing is you, a healthy young person, could be carrying it and you don't know. And that is why we're wearing the masks. It's more to protect the people that are around us if we are a healthy person that might have it and we don't know. So the mask covers any kind of invisible droplets that happen even just from talking. The most important thing is washing your hands. That I think is the one thing that we've heard again and again, but to me, in my experience, it's the most important thing.
I had another question. I was just wondering, are the same symptoms that are shown in adults for like COVID-19 shown in kids? And like, how would you see that?
With little ones, often they're asymptomatic, honestly. So kids, they believe that children are exposed to so many different types of coronaviruses in a short period of time, which would be like the cold, the flu, things like that. Little ones who go to daycare get exposed to these coronaviruses so frequently and in such a short span of time that they often will be asymptomatic, or maybe have symptoms similar to like a young person, a young healthy person. So maybe a dry cough, a low-grade fever, fatigue, but like you probably wouldn't even notice it in a 2 or 3-year-old because they don't even often understand that they're fatigued. They just keep going. So they're mostly asymptomatic.
So just as like another question, it's due to the asymptomatic symptoms or like people not knowing they have it, and that's essentially why we have to do social distancing, right? So can you guys kind of talk about how social distancing will help like stop the curve, or like explain what the curve actually means?
So the reason that we are all being asked to socially distance ourselves is because we don't know that people are asymptomatic. And also, we simply don't have enough tests to be able to tell if somebody has it. Even if somebody has symptoms, there's not enough tests to know if the symptoms are the common cold or something less serious. So in order to minimize the risk of spreading this thing unknowingly, then we have to keep ourselves away from each other. And that is because we know for certain that this thing is spread by, they call it droplet, and that is those invisible droplets, like just when you talk, and then also coughing and sneezing, those types of things. But the scary thing is even just talking, and even simply talking, they say you can spread those invisible droplets as far as 6 feet. And that's why they tell us the 6 feet rule. And if we keep ourselves away from each other by 6 feet and we are not sharing doorknobs or, basketballs or anything else with our friends and neighbors, then we're minimizing the risk of spreading this thing. And because we know it's so communicable or easily spread, then for that reason, we have to take all the precautions, because if it is spread that easily, we know that there can be a spike, or let's say the curve goes higher than our hospital capacity. The whole reason that we have to minimize everything right now is because if the hospitals get overwhelmed, then we won't have the things that we need, like the ventilators and the personal protective equipment, to take care of everybody all at the same time. So it's not that we're minimizing the spread altogether, but we're making sure that when people do get sick, that they get sick at different times so the hospital can take care of everybody.
What is one of your number one concerns in the hospital, being at the front lines and taking care of all of this?
The thing that makes me most nervous is people that do have those underlying issues like cancer or heart disease or anything else. And the thing that scares me the most is people having to be alone during those really scary times. That's what makes me the most sad. And I've seen it personally. I've seen people who have just been through the worst things in the hospital and they don't get to be with their families. So that's really hard.
I was just wondering, how do they divide people who have the symptoms and people who are just there for other sickly issues? How do they do that in the hospital?
The old hospital is housing the COVID patients. So all of the people that have other problems, they're trying to keep them separate, but it's really difficult to do that, because the other problem is the way the hospital was designed is those isolation rooms. They call it negative pressure rooms. They call it that because this means that all of the air that's being pulled into that room doesn't get redistributed out into the rest of the hospital. So it's negative pressure. Those rooms are kind of distributed randomly throughout the hospital. So they try to put all the COVID patients in those rooms so that we're not sharing the same air, but it doesn't always happen that way. And if they do that, then they can't always keep cancer patients far away from the COVID patients. And I'll actually talk to one more thing, because this is just kind of an interesting story that I'll share. When all of this first started happening, there was nobody had a plan for how to bring these patients in and how to do it in a way that made sense. So it was chaos at first. And actually, things have gotten a lot better and we are handling it very differently and a lot better at Stanford. But I remember going into the emergency room, and before they had the tent set up outside of the emergency room where anybody with a cough and fever went to the tent and they weren't allowed into the hospital or into the emergency room, they were allowing everybody in at first. And then they learned we can't keep bringing cancer patients in. I keep bringing up cancer because that's what I work in, so I'm sorry. But we can't keep bringing in all of these sick people into the same room as these people that have a cough and a fever. So eventually what they did is they set up this tent outside of the emergency room where those people got taken care of. Now this is California, so it's warmer. It's not so bad, but it is something that they had to learn to do. At first, it was not like that. So everybody's learning things in this time.
You want to brush up on your professional skills? Do you want to learn advanced computer skills and really become college and career ready? AES, Applied Education Systems, is here to help. All Cristo Rey Columbus students can access AES and the world of opportunities it provides. Just ask Cristo Rey student Jason Blankson, who says, "I love AES. It pushes college and career readiness. I wish there was an AES for all areas of my life." Ready to enroll? Simply log on to AES with your Cristo Rey email and enter the enrollment code. Not sure what it is? Contact your friendly PWSP coordinator for help. AES, preparing students for college, career, and beyond.
So last episode, we spent some time talking about the government's response so far to COVID-19. And in Ohio, we're seeing a really kind of vigorous and public response from the state government. I was just curious, do you feel like that vigorous state government response is there in California?
Yeah, actually, I think that California, so specifically San Francisco, was our mayor was the first person to put these shelter-in-place orders in, and I do feel that our mayor is taking this all very seriously and responding very quickly. So I'm really proud of San Francisco and the Bay Area in general. And California also has been doing a lot. The governor was a little more slow to respond, but still pretty quick. I don't remember when California went down an official lockdown, but I think it was similar to Ohio. At that point, though, California had a lot more cases. So I would say California was a little slower than Ohio as a whole, but the Bay Area was really quick. And I will tell you the things that California is doing as a state, it's actually quite robust. We have a very specific problem here. It's specific to California, and that is homelessness. And that is something that they really had to figure out a good way to tackle, and a way that really respected people's humanity, but really also minimized the risk for everybody living in the city, including those people that were living on the streets. So the people that were suffering from homelessness, the things that they did is they tested people. Anybody that was tested negative, they're being housed in a convention center in the city. So they're no longer living on the streets. And then anybody that was tested positive, they're housing them in hotel rooms and also RVs. Now, that's a big deal. They also are putting up, they put up hand washing stations all throughout the city that anybody can use. And also the state of California opened up the healthcare marketplace where you can sign up for your insurance. If you're on Medi-Cal, they opened that back up so people can sign up for health insurance if they didn't already do that. That's also a big deal. And another thing that California did, they're expanding the people that are applying for unemployment. I think that the state of this, or the entire country, is doing that, but California is doing also specific things for our employees too. And they're also stopping any evictions that up until I think June.
If you, as two people who work in the medical field, what's one thing that either state or national or local government could do that you think would really help curb the effects of this outbreak?
We need to have a national stay-at-home order. I think we're piecemealing. We've got, some states that are staying home and everybody's doing different things. And I think there just needs to be a more cohesive response rather than governors having to take the lead, because we're going to have more hotspots and issues in certain parts of the country. And I think it's going to go on longer in certain parts of the country, and we're going to see more problems. And if we could just all work together, have some direction federally, then I think it would be helpful.
I think probably above that is expanding testing. That would be the number one thing. If we had clear direction, that would help a lot. And I think above all, if we just really knew what was happening in each of these places, we knew very clearly, then we would have a better idea of what to do next. But the issue is we are not testing enough. So we really don't know what's going on. And so we're all scared. So we're all being told to stay at home. What is well known by the CDC is that there are asymptomatic people walking around that are positive. And if we knew how many, that would help a lot.
Right.
What do you guys think are some things that you would want to share with your classmates and the Cristo Rey community at large after hearing some of what Nurse Ross and Nurse Hunt had to say?
Well, I want to let our students know that we're not immune to this illness, that a lot of people, especially I know in our school, think that they will be fine, that this is only going towards people that are already ill. But the fact is that anyone could get COVID-19, and the spread of it can be bad, really bad, and you can start infecting your family members, and it just can create more chaos than it already is. And I feel like by staying home and taking cautious, this will end quickly. You just have to gain patience over this pandemic.
Yeah, I totally agree with Ruby. She's like 100% correct because, like everybody's been saying, most people tend to think that this is a myth and it's not real. It doesn't exist and it might not harm you, but it's real. And as you can see, we have a person all the way from California who's telling us about the effects of it there. And it's telling you that it's really happening. People are literally being separated in hospitals. People aren't being able to like get ventilators, and it's a very difficult time. And you can see it in real life. People are wearing masks outside more often. I know more stores have been like putting in place that 6 feet apart thing. Like at my job, we didn't really really instill that at the beginning, but now it's like for sure, like they don't even let people in unless you're 6 feet apart. We tried to go to the store yesterday real quick to get some essentials, and they wouldn't even let us in unless 6 people came out. It's serious. It's very serious, and we need to see that. I remember I was watching a YouTube video, and people in California, apparently they tend to like be driving back and forth all the time. And it's like a known thing everywhere. And this YouTube video, they were saying nobody's on the road, nobody's on the freeway. It's completely clear, like nobody's going anywhere. So this is a pandemic. It's really serious, and we need to keep that in mind. So
I would say, to reiterate both Ruby and Brianna and both nurses' points, is everyone has the potential to do one thing. Your one choice can dictate whether we continue this pandemic or end it. Every individual has a choice to stay home, take the precautions, and you're keeping people safe. Because the biggest scare is the asymptomatic symptoms of not knowing. You thinking, well, I'm healthy, I'm fine, I'm young, I won't be in danger. But you not being in danger doesn't mean you can't stop other people from being in danger. So take your action. Just make sure your family and your family's friends are like, hey, this is the reason why we do this. Stay in the home, go out and leave for essentials, but also to make sure to take care of the mental self. Because a lot of this isolation, a lot of people aren't talking about, is through isolation becomes a time being a burden for that individual. A lot of people aren't as comfortable with themselves or their family aspect. So do something that helps you become you.
Well, in my personal experience, I've seen that this pandemic has really put a toll on my mental health. And I feel like this was a way in order for us to realize the things that we're not really doing in our day-to-day lives. Like, for example, I'm not a very active person. And I've realized through this time of the pandemic that I wasn't really focusing on my health before all of this, and now I can actually try to make some progress in my life, in which can later go out for the long run after this pandemic. I feel like stronger, and I feel like if we can focus on the things that we're lacking of, we can get something good out of this.
Yeah, exactly what Ruby and Nehemiah said. Good job, Ruby. Very proud. Being at home, I feel like for a lot of students, it is affecting our mental health. I never realized how much I liked hanging out with friends until I was just like not with them, or how much I like going out to watch the movies or go shopping and all of that. And this just really made me realize that. And it's really important that we emphasize our own mental health and do what you can do best at your own home, just to stay safe. Because although it's really pretty outside, and although you want to go shopping, the best thing for you to do is keep your family and yourself safe.
I think Nehemiah's point about we all have an opportunity here to take actions that can hopefully stop the spread and be proactive and be engaged. And then Ruby's advice too, you know, there's opportunities here to find some silver linings and learn from our experiences, and hopefully move forward more informed and more aware. Well, thank you all for being here. A big thank you to both of our medical professional guests, and we'll see everybody. We'll do a post spring break episode in 2 weeks.
Podcast. This was the Cristo Rey podcast. The Cristo Rey podcast. It came right at you. Spring break. Hey, now it is spring break. How can we have spring break when we don't go to school? It's time to stuff your face with Cadbury cream eggs. What about Peeps? I don't know, they kind of freak me out. Don't put them in the microwave no matter what you do. And with chocolate bunnies, always eat the ears first. You must always eat the ears first. Podcast. This was the Cristo Rey podcast. The Cristo Rey podcast. Blah, 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 blah. Podcast. Something, something podcast. podcast. Yeah, podcast. Happy Easter.